Hi, my name is Ricky and I'm one of the nurses in the MST clinic. Today I'm going to talk with you a little bit about dilation and douching. These are both things that you will do after vaginoplasty surgery. About 6 days after surgery, a surgeon and nurse will come see you in the hospital and they will take the packing out of your vagina. This will be the first time you dilate. You will receive a set of dilators just like this, and they will show you how to dilate. The dilators have little dots on them. I call them depth dots. And the first time you dilate, the nurse will let you know which dot you want to get to every time you dilate. When you insert the dilator, you will insert it with the curved end in, sort of like that, and then your depth will be up to that dot. If at any time you are having a hard time getting to that depth, please go ahead and contact the surgeon. At that time, they will also tell you what your schedule is for dilation, as well as when to move from size to size. One of the things that can really make dilating easier is using a lot of lube, or enough lube for it to actually really slide in. We tell people in the beginning that it's really important to give yourself about an hour to dilate, setting up, making sure that you have all of the things you need in front of you so that you don't need to run to get something at the very last minute. And then actually doing the dilation and making sure that sometimes in the beginning it can be a little bit stressful, really giving yourself time to relax and do it as you need to, and then clean up as well. I tell people that dilating is sort of like exercise. If you don't do it today, chances are you're not going to do it tomorrow, and the next thing you know, a week has gone by and you haven't dilated. We will also send you out a handout with all of this information so that you have something to refer to, and they will also give you a schedule in the hospital at discharge. Now I would like to move on to douching. So douching is something that you will generally do about once a week. The nurse who does all the teaching with you after surgery will give you a better sense of that, but typically it's about once a week. They will give you a container just like this and a syringe that looks like this. Once a week you will fill this container with water and about a dime size full of natural soap, like Castile soap. You will draw the water up into the syringe and flush out your vagina. If you have sex with somebody and there is semen involved, you want to make sure and douche that day. People typically douche in the shower because all the water that goes in then comes back out. This is the information that I have for you today about dilation and douching. As you get closer to surgery and then after surgery, the nurses at Gender Pathways will go into more depth with you and provide you with more information about the specific details. Thank you for watching.